Welcome, everybody. My name is Edward Shin, and I'm CEO and co-founder of Quality Reviews. And thank you for joining our webcast today. Quality Reviews helps healthcare providers improve patient experience through real-time feedback. And today's topic is a very relevant one. It's the relationship between nurse satisfaction and patient experience. And today, we have two great speakers. I'd like to introduce them. Amy Pettit is Chief Nursing Officer and VP of Nursing at Schneck Medical Center in Seymour, Indiana. And we have Baldomero Silva, who is Vice President of Total Rewards at Grady Health System in Atlanta, Georgia. So thank you and welcome, Amy. Welcome, Baldomero.
Thank you.
So we're just going to dive right into it. The New York Times last week published an article on this very topic. And obviously with COVID, this has put a lot of pressure on the nursing profession. And there was a recent survey by NurseGrid here that says the percentage of nurses reporting that they are suffering from burnout has doubled during the pandemic to more than 60% in December of 2020 from 25% in April of 2020. So we'll start right there. I'm going to turn it over to Amy Pettit. I know you have a lot of experience in this area and your doctoral thesis was on this very topic. So I'm going to turn it over to you, just get your initial thoughts on the state of the nursing profession and then we can talk about its relationship to patient experience.
Sure. Well, thank you for having me. I think what's important to realize is that the topic of nurse burnout is not a new topic. It's something that we in healthcare have dealt with for years and years now. And in fact, pre-COVID, on average, about 31.4% of nurses reported high level of burnout. And that ranged from anywhere in the lowest quartile to 16% and the highest quartile to about 49%. So while the statistics that you provided from the New York Times article are about 60%, it's not surprising. Having come through a year in a pandemic and having to deal with everything that we've dealt with, those numbers are not really surprising. And I think that the literature has a lot of information on burnout and how we can maybe make improvements.
And talk to us a little bit about your doctoral dissertation, because I know this was the topic that you studied, and talk to us a little bit about what you discovered in your research.
So about 5 years ago, I graduated from the University of Southern Indiana with my doctorate degree in nursing. And my project was all about linking nurse satisfaction to patient satisfaction. And again, how the two interacted and how they played on each other, understanding that if you can improve nurse satisfaction, decrease burnout is what we're talking about. What does it do, or what type of an effect does it have on overall patient satisfaction scores? And when you look at the literature, when you look at the research and the data, and even the small amount of data that I pulled from our Schneck Medical Center, rural community hospital, the information that linked nurse satisfaction, decrease in burnout, to patient satisfaction is substantial and statistically significant. And when you look at linking the two.
Got it. Thank you for that intro. And Baldomero, so you have a great background, extensive HR management experience in retail, Walmart and Kroger. And you recently joined Grady. What have you seen from your vantage point, kind of in that human resource perspective during the last year in terms of what nursing and the nurses at Grady have gone through, and how have you supported them?
Yes, so you're absolutely right. Very similar to what Amy has described. As the pandemic kept coming and going, and really, as we thought it was going to come to a little bit of a tail, it never really did, and hasn't yet. And again, we're keeping a close eye at it. Retail is fast paced, and coming over to the health industry, it's just as fast or faster. So there's no slowing down. And some of the things that we've tried to do over here at Grady is we've applied some of the things that we did in retail, and they're not easy to do.